Hello everyone, I am Dr. Swati Mehta. Our today's topic is constipation during pregnancy. Constipation is very common during pregnancy because many conventional medicines are not recommended at this time. So homeopathic remedies are often chosen, and these medicines aim to provide relief from constipation safely and gently for a pregnant woman. First of all, we must know what is constipation. It is a passage of hard, dry bowel movements, usually fewer than 3 times a week. The symptoms are painful bowel movements, a bloated abdomen, uncomfortable feeling, and sluggishness. It is said that if more than 3 days pass without a bowel movement, the intestinal contents may harden and a person may have difficulty or even pain during elimination. Straining during bowel movements of the feeling of incomplete evacuation, and that may lead to abortion in case of a pregnant woman. Constipation is a symptom and it is not a disease. Constipation during pregnancy is very common during pregnancy, and it is usually happen because of a mix of hormonal, physical and lifestyle changes. Here are the main cause explained simply. Progesterone increase during pregnancy because of the maintenance of the pregnancy, and this hormone relaxes the muscles of the intestine, so bowel movements become slower and harder. As the growth of the baby inside the uterus, it causes pressure on the intestine because the situation of the uterus is between the bladder and the rectum. The iron and calcium supplements must be given during this pregnancy period, and the iron tablets sometimes causes constipation. There is decreased fluid intake because during pregnancy a woman cannot be able to take proper fluid or water, and because of that the digestion becomes slow. During pregnancy the physical activity is reduced because we consider that pregnancy she must not do any physical proper work, and because of that she has a bed rest, and that reduces the bowel stimulation. Ignoring the urge to pass stool, this is very common with the female because sometimes she does not want to go for defecation. The stress and anxiety are another cause, that is the emotional stress, and that affect the gut movement. Nausea and vomiting in early pregnancy, that leads to loss of fluid, and that leads to constipation. What the woman has to do during pregnancy to avoid constipation is drink more fluids, at least 8 to 10 glasses per day. Warm water in the morning, that helps to stimulate the bowel movement. Increase the fiber intake like papaya, apple with the skin, apple and carrot. In our country, it is believed that papaya cannot be have during pregnancy because it causes abortion. That is the wrong belief. Papaya is having lots of vitamin A and having fibers, so patient will have help in constipation. Even oat, brown rice and the soak raisin is also helpful for removing the constipation. Gentle exercise means every time we are advising patient to have some exercise or walking 20 to 30 minutes daily. And prenatal yoga, nowadays it is very common with the young generation, and that help to remove constipation. And the main thing is, do not ignore the urge. Go to the toilet as soon as the patient feels urge. Safe home remedies include taking 1 to 2 tablespoons of isabgol with warm water at night, or 1 tablespoon with warm milk before bedtime. It should be taken in a small quantities because excessive bowel stimulation may increase rectal movement, which could potentially stimulate uterine movement and increase the risk of complications during pregnancy. Here we have to avoid castor oil and strong stimulant laxatives, and enema and suppositories. As I discussed previously, that many conventional medicines are not recommended at this time, that is during pregnancy. So homeopathic remedies are often chosen, and these medicines aim to provide relief from the constipation safely and gently for pregnant women. And all this I am describing here are my own clinical experience. Natrum sulph is sometimes considered in constipation during pregnancy when symptoms are complex. Although it is commonly associated with loose morning stools, flatulence and aggravation before breakfast or in damp weather, it may still be useful when constipation is marked by a large fecal mass and involuntary stool while passing flatus. So this is the important symptom. The patient may experience burning in abdomen and anus, bruised pain and strong urging. Mentally, the patient may show sadness aggravated by music and dim light, suspicion, fear of crowds or fear of evil, and a desire for solitude. Emotional relief and cheerfulness are noted after stools. So emotion is one of the cause of constipation we already discussed previously. As natrum sulph is also related to liver and pancreatic disorders, it may be considered when constipation during pregnancy is associated with diabetes or any liver disorders. Plumbum metallicum is indicated in constipation during pregnancy when stools are hard, dry, black and lumpy, passed with severe urging and intense spasmodic pain of the anus. So constant urging is one of the cause of constipation. There is obstructed evacuation due to indurated fecal impaction, marked dryness of the stools, and possible paralysis of the muscular atony affecting the rectal function. So if you go to the causative factors, we can find out that lack of fluid in the body reduce the movement of the intestines. So dryness is the cause of constipation. The rectum and anus shows strong constriction with excessive abdominal pain radiating throughout the body. Symptoms develop slowly and progressively, leading to violent, obstinate constipation. The medicine primarily affects the muscles, nerves, abdomen, and spinal cord. So again, muscles are affected, and that is one of the cause of constipation we already discussed. Mentally, the patient is timid, restless, and anxious with fear of assassination, poisoning, or being harmed. There may be nocturnal delirium, loss of memory, mental slowness, apathy, and delirium, which is aggravated by music or being watched. Platina is indicated in constipation during pregnancy, especially while traveling with frequent changes in food and water. Constipation results from inertia of the bowels with frequent unsuccessful urging and a sensation of stool remaining in the rectum and anus. Stools are scanty, obstinate, hard, or appear burnt, sometimes like soft clay, with growling and itching at the anus, worse in the evening. So here both type of stools we can find: soft stool like clay, or a hard stool or dry stool. Abdominal pain is centered around the umbilical region and extend to the back, causing the patient to twist and turn for relief. So this movement also harmful for a pregnant woman. Mentally, the patient is proud, arrogant, oversensitive and erotic with marked mood changes. Nux vomica is indicated in constipation during pregnancy in a woman who are very particular, careful, easily excited and prone to anger, often leading a sedentary, mentally stressful modern life. Constipation is marked by frequent ineffectual urging, scanty stools passed with great effort, and an incomplete, unsatisfactory feeling as if stool remains unexpelled due to rectal constriction and irregular peristalsis. So again, we have already discussed the causes previously. Here you can find out the cause. And anger, that is emotional disturbance, is also one of the cause. The main thing in nux vomica is frequent ineffectual urging, and every time patient is passing the stool in very small quantity. There may be alternating constipation and diarrhea, especially after prior abuse of purgatives before pregnancy. So if patient is having history of using purgatives before pregnancy, we can use this medicine for constipation during pregnancy. Opium is indicated in obstinate constipation during pregnancy in well-nourished women where constipation is due to inaction or paralysis of intestine. Again, we can go through the previous causes. This is one of the cause. There is no desire for stool. Feces may be hard, round, black balls that protrudes and then recedes, or there may be a spasmodic retention of stool in the intestines. Stools can be involuntary, black, offensive and foul smelling with violent rectal pain as from pressure. The condition is associated with paralytic atony of the bowels and bladder, sometimes following fright or after effects of inhaling gas or charcoal vapor. So these medicines we can use in those who are using the chulha. Mentally, the patient shows loss of concentration, judgment and self-control with stupor, drowsiness, sluggishness, dreaminess, talkativeness, lack of willpower, and complaints aggravated during sleep or spasms. Alumina is indicated in constipation during pregnancy when there is no desire and no ability to pass stool until a large accumulation occurs. So patient will pass stool 1 or 2 days, or patient will tell you that I am passing stool every third day. Even soft stool requires great straining, with the patient needing to grasp the seat firmly. Stool are hard, knotty like laurel berries, or soft but adhering to the rectum due to inactivity and dryness of the intestinal mucosa. So here you can compare it with the platina. Evacuation is preceded by long-lasting painful urging. Similar straining is required for urination with slow flow. The patient is thin, weak, inactive, prefers to lie down, though it increases fatigue, feels pulsation in different parts of the body, and has impaired coordination, such as difficulty in walking with the closing eyes. So alumina is used for the young woman who is emotionally disturbed too. Lycopodium is indicated in constipation during pregnancy where there is a long history of constipation since puberty or previous pregnancy. So here past history is important. Constipation is worse when away from home with ineffectual urging due to rectal constriction. The stools are hard, small, difficult and incomplete with an inactive intestinal canal. There is marked flatulence, acidity and burning eructations rising to the throat. Digestive weakness gradually affects the nutrition and liver functions, leading to mental and physical fatigue. So here we can consider digestive weakness means intestines are not working properly. The patient is thin, chilly with poor circulation, dryness of the skin and palms, soles and vagina, and is aggravated by milk. Mentally, the patient is intellectually keen but lack of self-confidence, is sensitive, fearful of new people, hesitant to take a new task, easily angered or saddened, hurried while eating and desire very hot food. and this is aggravated by milk. That means patient is not bear milk. So patient will tell you that I am having constipation when I am having milk. Then we can use lycopodium. Podophyllum is indicated in constipation during pregnancy with hard clay colored or chalky stool. Again, alumina and platina we have to compare. Often alternating with diarrhea. If chief affects the rectum and intestines, producing a weak, empty, sinking sensation in the abdomen that is relieved by rubbing. The rectum feels raw and sore. Mentally, the patient may be loquacious, restless, unable to sit still, with anxiety and a fear or impression of impending death, along with sexual frigidity. Now, sepia is indicated in constipation during pregnancy in weak, relaxed, pot-bellied multigravida woman. So here multigravida is important. There is a characteristic faint, sinking sensation at the epigastrium, not relieved by eating. Stools are hard, knotty, dark brown, balls-like, often glued together with mucus. Even soft stools are difficult to evacuate. Again, we can comparison with platina, alumina, podophyllum and all. There is sensation of ball in rectum. Pain persists during and long after the stool. Rectal prolapse and constant oozing of mucus from the anus may be present. So, multigravida patient may have prolapse of rectum too. Mentally, the patient is irritable, indifferent to family, aversion to sympathy and company, yet fears of being alone. So, this is also a controversial symptom. Desire for someone but fear to being alone and aversion to the company. Yeah, this is important. Sorry. With poor memory and marked emotional exhaustion, sometimes with despair of suicidal thoughts. Bryonia is indicated in constipation during pregnancy when there is marked inactivity of the rectum with no desire for stool. So again we can compare it with the opium. Stools are very large, hard, dark and dry as if burnt, often followed by passage of tough mucus. The remedy acts strongly on serous and mucous membranes, causing extreme dryness, scanty and adherent secretions, and dry rough skin. A characteristic feature is intense thirst for large quantity of cold water despite constipation. So patient is drinking much more water, then also she develops constipation. The tongue is dry, rough and coated in the center. Mentally, the patient is irritable, dull, prefers to be alone, shows a mood swings, and often desire things but reject them when offered. So these mood swings are very common during pregnancy, especially in those who are primigravida. Among the remedies discussed, opium, bryonia, alumina, nux vomica and sepia have been used most frequently with good results in constipation during pregnancy, which I had already did in my practice, and I am using this since 40 years of my practice. These medicines may be selected based on clear symptoms, similarity, or even one or two strong characteristic symptoms. With careful individualization, they can be effective in clinical practice. I am thankful for watching the video. I am thankful to all those who wants to use these medicines in their practice and can get the good results and relieve the patient from the constipation during pregnancy. Thank you so much.